Hello, everybody. Welcome again to our second episode of our podcast, Between the Lens. I'm so glad that you're here today so that we can have a conversation. And today I've got something amazing lined up for you. I know many of you have been asking, we've had a lot of investment in healthcare. Every day there's someone somewhere that is unwell, or every day there is someone who is added into our WhatsApp group so that they can make contribution towards paying a medical bill or towards facilitating someone who has been hospitalized. And that has become a norm. It has become something common. And I think every time when you plan your budget, there's always the miscellaneous that you have to put aside because these things happen. And today we are going to focus on a very interesting bit of our conversation. And the topic for today is something closer to my heart, and it's about why public health is never about health. You know, Growing up, we were told, public health is about healthcare, it's about doctors, it's about medical practitioners. But I think things are changing. And as things are changing, then what does that require us to do? By the way, health is not created in hospitals. We've seen a lot of times investments being done in setting up very big facilities, political class launching facilities here and there. We hear like there are 40 beds that have been provided. But the question we should be asking ourselves is, where does healthcare start from? And I think healthcare is a very complex aspect. It all starts from where people live. You know, there are people who live in environments that look impressive, but again, all people will never be the same in the society. There are people who are low down there in the society, there are people who are in the middle class, and there are people who are way, way above, they are middle class. And one thing that I want us to agree, I know many of us are going to debate about it, but let's agree for once. Healthcare is not a public health issue. Healthcare is an economic issue. Healthcare is a social issue. Healthcare is a policy issue. And ultimately, healthcare is a political issue. So let me cycle you back to what I said. Today we are going to discuss and help you understand why public health is not just about health. There are other layers that are added to it that if we don't pay attention to, we are going to lose children, we are going to lose mothers, we are going to lose people. But I'm so happy that today you're listening to me because this is a wake-up call. A wake-up call in the sense that all of us have had these stories. Your zip code or your location could be a better predictor of your health more than your genetic code. You see, a child who is born somewhere in Australia may have like 5 times chances of survival than a child who is born somewhere in Lagos or somewhere in Kenya or somewhere in Uganda. And that's a plain reality that we've experienced. And I want you to think about it for a moment because how can we address factors beyond health so that we can ensure that people live their optimal life and people are able to fulfill their dream? And for those of you who are listening to me and perhaps you're not in the medical fraternity, I want to ask a very simple question. Why do people become sick? We've heard every time that, oh, so and so has been unwell for like a month, or so and so has been bedridden for a while now. So the biggest concern should be, why do people get sick? Is it because our current medicine focuses on treatment and we neglect prevention? Take a minute and reflect on that. Because for a very long time, we've seen public health focusing more about dispensing. You come complaining with a headache, you're given bundles of medicine. You come complaining of some back pain, you're given bundles of medicine. But I think it's a high time that public health should now think about examining systems. Public health should go further to start understanding the environment under which people live, or the environment under which people operate from, and conditions that influence their overall perspectives around healthcare. And I think if we can understand these kind of distinctions, then we'll be on the right track in terms of our public health approach, as well as our public health approach and response. And wellness is a journey. Wellness begins way long before someone actually walks into a hospital. And it all starts from aspects that we call social determinants of health. And one of it is education. You see, education is a critical enabler when it comes to accessing better job, accessing better opportunities, getting better remuneration and payment. Of course, it's not standard that if you're educated, you'll have access to these opportunities, but there are high chances. Research has already shown that when you're educated, when you're empowered, then you have better opportunities to access income and get resources that can allow you to live perhaps in a better environment, access better nutrition, and even access, better early prevention, methodologies or approaches. You can go for screening. But if you're not educated, the inverse is true. Getting jobs may be difficult. Living in better places may be a nightmare. And number two is housing. The other day I saw a housing forum that was held somewhere in Azerbaijan. I can't tell the name correctly, but I think there was a housing forum that was being hosted. And housing is critical. The places under which you spend the rest of your life, the conditions under which you live, really determine the kind of illnesses, the kind of sicknesses that you're bound to experience as a person. And right now we are calling upon government, we are calling upon private sector to start uplifting people, start upgrading the environments under which people live. For a very long time, Africa has been known for having the largest slums. But what can we do? We've seen a lot of slum upgrading happening. We've seen a lot of people being supported so that they can have better environments. They can live in better housing. And this limits them from getting exposure to potential diseases and harm. And of course, employment is critical. You show me a human being who can access better nutrition when they cannot even have a job. That's why we call upon government and sector players to really create enabling environments so that people can get jobs. Then when people can get jobs, it means they can afford to live the life that they want. They can afford even to have 3 meals a day. They can even afford to go for medical checkups. And this is what we are calling upon. The income, variability is big in many of the places where we're coming from. The gap between the poor and the rich is widening every day. But what we are calling upon is, can we create opportunities? Can we create systems? Can we create ripple effect in the society that will allow people get an opportunities to contribute towards national development? And as a result of that, people are able to earn decent income and decide what they like to do with that. You see, Africa is a home of, billions of people, but young people are still disadvantaged. They are the ones who are jobless. They are the ones who are getting into crime. They are the ones who are living, the worst life. So it's a wake-up call. We have the potential as Africa. Africa is a market for the whole world. But what are we doing for our people? Food security. Better nutrition is number one treatment. If you don't have better nutrition, you are prone to diseases. You are prone to becoming sick anytime. So we are calling upon everyone to really think about factors that make it easier for us to keep diseases away and have a healthy society. But of course, safe communities, because you cannot really, talk about, healthcare or optimal living if you're living in an unsafe environment, unsafe in terms of security, unsafe in terms of environmental degradation. And I think in our conversation today, these are some of the issues that underpin development. 21st century development is not like 1960. Things have changed. And it's a high time that our leaders, our people start paying attention to the things that affect us as people. And of course, access to opportunity. We are in an era of technology. We are in an era of AI. Let's empower people. Let's give people the skills, the capacity that they need, so that at the end of the day, they can decide the kind of life that they want to live. And of course, we cannot talk about public health without linking it to economics. And I've already said nutrition, housing quality, access to healthcare. Economics matter a lot. And right now, we've seen what's happening globally. Countries, powers are engaging each other. We've seen a lot of economic shocks. And anytime there are economic shocks, then definitely who suffers the most? The people. You're unable to do your job. You're unable to go to school. You're unable to access food in time. So it really becomes difficult. And of course, I mentioned earlier, public health starts from the society. The kind of family structures that we come from. They really determine how healthy we live. The kind of communities that we belong to, or the kind of communities that we affiliate with. The community beliefs, they shape our perspective. They shape how we see things and how we respond. The culture, there are places where certain norms are accepted, but again, there are places where certain norms could put you at a greater risk of contracting diseases or even becoming unwell. And of course, even the institutions that we affiliate with, they really play a critical role. How we trust or how we build cohesion, these are critical layers that you may not think about, but in a bigger way, they influence the kind of life we live, they influence the kind of health outcomes that we get at the end of the day. And of course, every policy is a health policy, because if today there is a policy around housing, trust me, it has a dotted line to the health outcomes of the people. If today there's an education policy that is passed out there that says there is no return to school for girls who get pregnant, then in some way it will disadvantage them and they'll get exposed a lot to pregnancy, STIs, HIV, name them all. And of course, even a transportation policy, if there are shifts in terms of the transport sector, how does that impact healthcare delivery and the overall well-being of the people? And as I get closer to wrapping up our episode for today, I want us to start looking at public health from a systems level. All these different things that I've highlighted, they underpin an aspect that we call systems thinking. We cannot address public health challenges if you're not working collaboratively. You see, we've seen people who present issues or they present with asthma. It could be linked to air pollution or poor air quality. What can we do for the players in that sector? What can we do? We've seen diabetes. There's been a rise in terms of diabetes in the society. At least one or two people that they know someone who has been diabetic before. What can we do? Maybe it could be addressed through nutrition. So what I'm trying to say is that public health for the 21st century is not the public health that we used to know. Everybody nowadays is saying like, hey, I'm stressed. Why? It could be because they don't have access to economic opportunities. Why don't we create opportunities to empower people? We've seen mental health becoming a crisis. Why could this be a scenario? Maybe it's because of isolation. The kind of environment, the kind of spaces that we find ourselves in, we don't get to bond, we don't get to connect. And of course, injury and unsafe infrastructure. How many times have we heard about work-related injuries? So I think it's about building systems that put people at the center. It's about building systems that last beyond the current challenges. And of course, I cannot wrap this conversation without centering it back to the leadership, because public health is a definite reflection of the kind of leadership that we have. Strong leadership creates better infrastructure. When mothers are unwell and they cannot arrive in the hospital within the shortest time, we're going to lose people. It's about putting better education infrastructure so that people can be empowered. Their human capacity and index can improve so that they get opportunities to work locally, work internationally. I mean, the world has become a global village. Better economic opportunities mean people have more within their capacity to spend and improve their lives. And again, better housing conditions. Who doesn't want to live in the leafy suburbs of the neighborhood? Everybody wants to live there. And of course, better public services. I think public utility is one of the underrated aspects. But leadership is about ensuring that all these different aspects, all these different components, they are available so that they can fit into one comprehensive story. And as I wrap up, my question will be, how do we treat illness? I think the best way to treat illness is to start diagnosing the systems. I've already talked about education, healthcare, everything that is around us. It really determines the quality of life that we live and the quality of outcomes that we register. So I think public health is not just about health. It's about sociology. It's about public policy. It's about leadership. It's about governance. And ultimately, it's about the kind of society that we want to build. Because healthier populations are not created by healthcare systems alone. They are created by conditions, by opportunities, and decisions that we make as a collective to shape our day-to-day life. So thank you so much for paying attention to our podcast for the day. If you have any comment or if you have any reflection, feel free to drop it on the comment section. And I look forward to seeing you on the next. And if you're new and you have not had a chance to subscribe to our channel, what are you waiting for? I mean, I want you to join the caravan. Let's have these amazing conversations. And yeah, can't wait to see you on the next. Bye. Bye for now.